73% of men over 60 are not getting enough of this vitamin, and this deficiency is causing their prostates to grow larger each passing day, turning their nights into living hell. My name is Dr. Diana Ross, and for over 20 years, I have been helping men reclaim their strength, restore their sleep, and regain their confidence without relying on dangerous medications or invasive procedures. Today, I will reveal the one vitamin that pharmaceutical companies do not want you to know about, because it can naturally shrink an enlarged prostate and restore your quality of life. 1. The hidden vitamin crisis. Most men over 60 assume that frequent nighttime urination, weak stream, and constant discomfort are just natural parts of aging. But what they do not realize is that their prostate problems often stem from a critical deficiency in vitamin D. This vitamin, which your body produces when exposed to sunlight, becomes increasingly difficult to synthesize as you age. Your skin becomes less efficient at converting sunlight into this vital nutrient, and most men spend their days indoors, creating a perfect storm for prostate enlargement. Clinical studies show that men with the lowest vitamin D levels have prostates that are 40% larger than those with optimal levels. The connection is undeniable, yet most doctors never test for this deficiency when treating prostate issues. Instead, they prescribe expensive medications that mask symptoms rather than addressing the root cause. Robert, a 68-year-old retired teacher from Ohio, came to me after years of sleepless nights and constant bathroom trips. His vitamin D levels were dangerously low at just 12 nanograms per milliliter, when they should have been at least 30. Within 3 months of proper supplementation, his prostate size decreased significantly, and he finally began sleeping through the night again. 2. The science behind vitamin D and prostate health. Vitamin D operates as a powerful hormone regulator within your prostate tissue. When levels are adequate, this vitamin activates specific genes that control cell growth and prevent the abnormal proliferation that leads to benign prostatic hyperplasia. The active form of vitamin D, known as calcitriol, binds to vitamin D receptors throughout your prostate gland, essentially telling cells when to grow and when to stop growing. Without sufficient vitamin D, these cellular breaks fail, allowing prostate tissue to expand unchecked. Research published in the Journal of Urology demonstrated that men with vitamin D levels above 40 nanograms per milliliter had a 67% lower risk of developing aggressive prostate enlargement compared to those with deficient levels. The vitamin also reduces inflammation within prostate tissue by suppressing inflammatory cytokines that contribute to swelling and discomfort. Additionally, vitamin D enhances your immune system's ability to identify and eliminate abnormal prostate cells before they can multiply. This protective mechanism becomes increasingly important as men age, since cellular repair processes naturally slow down over time. The vitamin also improves blood flow to the prostate region, ensuring that healthy nutrients can reach the tissue while waste products are efficiently removed. 3. Why traditional treatments fail. Most conventional prostate treatments focus on blocking hormones or relaxing muscles, but they completely ignore the underlying vitamin deficiency that drives prostate enlargement in the first place. Alpha blockers like tamsulosin may temporarily improve urine flow, but they do nothing to address the root cause of prostate growth. 5-alpha reductase inhibitors such as finasteride can shrink the prostate slightly, but they often come with devastating side effects, including erectile dysfunction and decreased libido. These medications work by suppressing dihydrotestosterone, a hormone necessary for male vitality and sexual function. Meanwhile, vitamin D supplementation addresses prostate enlargement at the cellular level without compromising your masculinity or sexual health. The vitamin actually supports healthy testosterone production while simultaneously preventing prostate cells from growing out of control. Unlike prescription medications that must be taken indefinitely, proper vitamin D levels can provide lasting benefits that continue even after supplementation ends. Many men report feeling more energetic, mentally sharper, and physically stronger when their vitamin D levels are optimized. James, a 72-year-old contractor, struggled with prostate medications that left him feeling weak and uninterested in intimacy with his wife. After switching to high-dose vitamin D supplementation under medical supervision, his prostate symptoms improved dramatically, while his energy and vitality returned to levels he had not experienced in years. 4. The optimal dosage protocol. The standard recommendation of 400 to 800 international units per day is woefully inadequate for men dealing with prostate issues. Clinical research indicates that men over 60 require between 4,000 and 6,000 international units daily to achieve therapeutic blood levels of vitamin D. However, the exact dosage depends on your current blood level, body weight, geographic location, and individual absorption capacity. Before beginning any supplementation protocol, you must have your 25-hydroxyvitamin D blood level tested to establish a baseline. Optimal levels for prostate health range between 50 and 80 nanograms per milliliter, significantly higher than the minimum levels recommended for bone health. Most men with prostate enlargement start with blood levels below 20 nanograms per milliliter, indicating severe deficiency. To correct this deficiency quickly, some physicians recommend loading doses of 10,000 international units daily for the first month, followed by maintenance doses of 4,000 to 6,000 international units daily. It is crucial to take vitamin D with a meal containing healthy fats, as this fat-soluble vitamin requires dietary fat for proper absorption. Magnesium supplementation is also essential, as this mineral is required for vitamin D metabolism and activation. Without adequate magnesium, even high doses of vitamin D may not provide optimal benefits. Regular monitoring through blood tests every 3 months ensures that levels remain within the therapeutic range without reaching potentially harmful levels above 100 nanograms per milliliter. 5. Natural food sources and absorption. While sunlight exposure remains the most natural way to produce vitamin D, most men over 60 cannot generate adequate amounts through sun exposure alone. Their skin becomes less efficient at synthesis, and many live in northern climates with limited sunshine, especially during winter months. Dietary sources of vitamin D are limited, but can provide valuable support when combined with supplementation. Fatty fish such as salmon, mackerel, sardines, and tuna contain significant amounts of vitamin D, with a 6-ounce serving of salmon providing approximately 800 international units. Wild-caught fish typically contain higher levels than farm-raised varieties due to their natural diet and sun exposure. Cod liver oil represents one of the richest dietary sources, providing over 1,000 international units per tablespoon, along with beneficial omega-3 fatty acids that support prostate health. Egg yolks from pasture-raised chickens contain meaningful amounts of vitamin D, particularly when the hens have access to sunlight and a natural diet. Mushrooms exposed to ultraviolet light during growth can provide plant-based vitamin D, making them an excellent option for men who prefer vegetarian sources. However, even with careful attention to dietary sources, most men cannot achieve therapeutic levels through food alone. Supplementation remains necessary for optimal prostate health, but combining supplements with natural food sources provides the best overall approach to maintaining adequate vitamin D levels throughout the year. 6. The inflammation connection. Chronic inflammation within the prostate gland creates a vicious cycle that perpetuates enlargement and symptoms. Vitamin D serves as a powerful anti-inflammatory agent, directly suppressing the production of inflammatory molecules that damage prostate tissue. When vitamin D levels are optimal, the vitamin activates genetic pathways that produce natural anti-inflammatory compounds, while simultaneously blocking the formation of inflammatory cytokines. This dual action helps calm existing inflammation, while preventing future inflammatory damage. Inflammatory markers such as interleukin-6 and tumor necrosis factor alpha are significantly elevated in men with enlarged prostates and low vitamin D levels. Correcting the vitamin deficiency leads to measurable reductions in these inflammatory markers within just 8 to 12 weeks. The anti-inflammatory effects of vitamin D extend beyond the prostate to benefit overall health, reducing the risk of cardiovascular disease, diabetes, and other chronic conditions common in older men. Michael, a 65-year-old executive, experienced not only prostate improvement, but also relief from joint pain and better sleep quality after optimizing his vitamin D levels. The vitamin helps regulate immune system responses, preventing the overactive immune reactions that contribute to chronic prostate inflammation. This immune-modulating effect is particularly important for men with autoimmune conditions or those taking medications that suppress immune function. By reducing systemic inflammation, vitamin D supplementation often leads to improvements in energy levels, mood, and overall sense of well-being that extend far beyond prostate health alone. 7. Timing and absorption. Optimization. The timing of vitamin D supplementation significantly impacts its effectiveness for prostate health. Taking the vitamin with your largest meal of the day, preferably one containing healthy fats, maximizes absorption and utilization. The fat-soluble nature of vitamin D means it requires dietary fat for optimal uptake in the small intestine. Meals containing avocado, nuts, olive oil, or fatty fish provide ideal conditions for vitamin D absorption. Many men make the mistake of taking their vitamin D supplement on an empty stomach or with a fat-free meal, resulting in poor absorption and minimal therapeutic benefit. The form of vitamin D supplement also matters significantly for bioavailability and effectiveness. Vitamin D3, also known as cholecalciferol, is the preferred form as it more closely matches the vitamin produced naturally in your skin. Vitamin D2, or ergocalciferol, is less effective at raising blood levels and maintaining them over time. Liquid vitamin D formulations often provide better absorption than tablets or capsules, particularly for men with digestive issues or reduced stomach acid production. Some men benefit from dividing their daily dose into smaller amounts taken with multiple meals, as this approach can improve absorption and maintain more consistent blood levels throughout the day. Certain medications, including proton pump inhibitors for acid reflux, can interfere with vitamin D absorption and may require higher doses or alternative supplementation strategies to achieve optimal levels. 8. Monitoring and safety considerations. Regular monitoring of vitamin D blood levels is essential for safe and effective supplementation, particularly at the higher doses required for prostate health benefits. The 25-hydroxyvitamin D test provides the most accurate assessment of your vitamin status and should be performed every 3 months during initial treatment. Target levels for prostate health range between 50 and 80 nanograms per milliliter, higher than the 30 nanograms per milliliter, typically considered adequate for bone health. Achieving these therapeutic levels often requires several months of consistent supplementation, as vitamin D builds up slowly in body tissues. Most men begin experiencing prostate improvements within 6 to 12 weeks of reaching optimal blood levels. While vitamin D toxicity is rare, levels above 100 nanograms per milliliter can lead to excessive calcium absorption, potentially causing kidney stones or cardiovascular complications. Symptoms of vitamin D excess include nausea, vomiting, weakness, and kidney problems. But these occur only at extremely high blood levels rarely seen with standard supplementation protocols. Men taking certain medications, including thiazide diuretics or digoxin, should work closely with their healthcare providers to monitor for potential interactions. Kidney function tests should be performed annually in men taking high-dose vitamin D supplements, as the vitamin affects calcium metabolism and kidney workload. The investment in regular monitoring pays significant dividends in terms of both safety and effectiveness, ensuring that you achieve optimal prostate benefits while avoiding potential complications. 9. Combining vitamin D with other nutrients. Vitamin D works synergistically with several other nutrients to maximize its prostate protective effects. Magnesium is perhaps the most critical cofactor, as this mineral is required for the conversion of vitamin D to its active form, calcitriol. Without adequate magnesium, even high doses of vitamin D may not provide optimal benefits for prostate health. Most men require between 400 and 600 milligrams of magnesium daily, preferably in the form of magnesium glycinate or magnesium citrate for better absorption. Vitamin K2 plays a crucial role in directing calcium to appropriate tissues, while preventing calcium accumulation in soft tissues such as arteries and prostate. This vitamin helps ensure that the calcium-regulating effects of vitamin D benefit bone health without causing harmful calcification elsewhere in the body. Zinc is another essential mineral for prostate health, as this nutrient is concentrated in healthy prostate tissue and supports immune function within the gland. Men over 60 often have zinc deficiencies that compound their prostate problems, making supplementation with 15 to 30 milligrams daily beneficial. Omega-3 fatty acids from fish oil work synergistically with vitamin D to reduce inflammation and support healthy prostate function. The combination of vitamin D and omega-3 fatty acids provides more powerful anti-inflammatory effects than either nutrient alone. Selenium, in doses of 100 to 200 micrograms daily, acts as a potent antioxidant that protects prostate cells from oxidative damage while supporting immune function. This comprehensive approach addresses multiple factors contributing to prostate enlargement rather than relying on a single nutrient alone. 10th, real-world success. Stories and timeline expectations. The transformation possible with proper vitamin D supplementation often exceeds what men expect from natural approaches to prostate health. Thomas, a 70-year-old retired police officer, came to me after years of waking up 5 to 6 times nightly to urinate. His vitamin D level was just 14 nanograms per milliliter, indicating severe deficiency. Within 2 months of taking 6,000 international units daily, his nighttime bathroom trips decreased to just once per night. By 6 months, his prostate size had decreased by 35%, and his quality of life improved dramatically. Richard, a 64-year-old accountant, experienced similar results, but also noticed improvements in energy levels, mood, and mental clarity that he had not expected. His wife reported that he seemed like a different person, more engaged and optimistic than he had been in years. The timeline for improvement typically follows a predictable pattern, with most men noticing initial symptom relief within 4 to 8 weeks of achieving optimal blood levels. Maximum benefits usually occur between 3 and 6 months of consistent supplementation. Some men experience continued improvements for up to a year as their prostate tissue gradually normalizes. The key to success lies in maintaining consistent supplementation and regular monitoring to ensure blood levels remain within the optimal range. Men who stop supplementation often see their symptoms return within several months, emphasizing the importance of viewing vitamin D as a long-term health strategy rather than a temporary fix. The investment in proper vitamin D supplementation typically costs less than $50 monthly, a fraction of the expense associated with prescription medications or surgical procedures, while providing benefits that extend far beyond prostate health alone. Every day you delay taking action is another day your prostate continues to grow larger, stealing more sleep and comfort from your life. The men who start vitamin D supplementation today will be sleeping peacefully within weeks, while those who wait will continue suffering needlessly. Your prostate problems will not improve on their own. They will only get worse with time. The choice between restless nights and peaceful sleep is entirely in your hands right now. If this video opened your eyes to the power of vitamin D for prostate health, please hit the like button and share it with other men who deserve to know this truth. Your engagement helps this life-changing information reach more men who are silently struggling. Subscribe to our channel and ring that notification bell so you never miss our latest discoveries in natural men's health. Drop a comment below and let me know if you plan to start vitamin D supplementation. I read every single message, and your success story could inspire others.